Breast cancer. These two words can spark fear and concern, but they can also inspire hope and action. Did you know that breast cancer is one of the most common cancers worldwide? It affects millions of women and men each year, but the good news is that with early detection and preventive measures, we can significantly reduce its impact. This video is your comprehensive guide to understanding breast cancer, recognizing its signs, and learning how to prevent it. Whether you're here for yourself or someone you care about, stay with us as we explore this vital topic together. Understanding breast cancer. So, what is breast cancer? At its core, breast cancer is a disease in which the cells in the breast grow uncontrollably. These cells can form a tumor, which can be benign, meaning non-cancerous, or malignant, which means cancerous. There are different types of breast cancer. The most common are invasive ductal carcinoma, which starts in the ducts that carry milk to the nipple. Invasive lobular carcinoma, which begins in the milk-producing glands. Breast cancer doesn't discriminate. It impacts women and men across all ages and backgrounds. Globally, breast cancer accounts for nearly 12% of all new cancer cases annually. While it is more common in women, men can also develop it, although this is rare. Signs and symptoms of breast cancer. Let's talk about the signs and symptoms of breast cancer. The earlier it's detected, the better the chances of effective treatment. Here are some common signs to look out for. 1. A lump or thickened area in the breast or underarm. 2. Changes in the shape or size of the breast. 3. Unusual nipple discharge, especially if it's bloody. 4. Dimpling or puckering of the skin on the breast. 5. Redness or scaling of the nipple or breast skin. Performing regular self-exams is a simple yet effective way to detect abnormalities. Here's how. 1. Stand in front of a mirror and observe any visible changes. 2. Use your fingertips to feel for lumps in a circular motion, starting from the outer part of your breast and moving inward. 3. Don't forget to check the underarm area. Remember, noticing a change doesn't always mean cancer. However, it's important to consult a healthcare professional if you detect anything unusual. Risk factors for breast cancer. Now, let's dive into what increases the risk of breast cancer. There are factors we can't control, and others we can. Non-modifiable risk factors include age. Most cases are diagnosed in women over 50. Genetics. If you have close relatives with breast cancer, your risk may be higher. Dense breast tissue. This can make it harder to detect cancer on a mammogram. But there are lifestyle changes you can make to lower your risk. Maintain a healthy weight. Exercise regularly, at least 150 minutes of moderate activity per week. Limit alcohol to no more than 1 drink per day, if any. Research is also ongoing into environmental factors, such as exposure to certain chemicals, and how they may affect breast cancer risk. Prevention strategies. Prevention is always better than cure. Regular screenings are a crucial step. For women aged 40 and older, mammograms are recommended annually or biennially depending on your risk level. Talk to your doctor about the right schedule for you. A balanced diet rich in fruits, vegetables, and whole grains can also play a role. Foods high in antioxidants, such as berries and leafy greens, may help protect your cells from damage. For those at high risk, medications like tamoxifen or raloxifene can reduce the likelihood of developing breast cancer. In extreme cases, preventive surgery may be considered. These options should always be discussed thoroughly with a healthcare provider. The role of early detection and treatment. Early detection can make all the difference. When caught early, breast cancer is more likely to be treated successfully. Common treatments include 1. Surgery, such as lumpectomy or mastectomy. 2. Chemotherapy and radiation to target cancer cells. 3. Hormonal therapies to block cancer growth in hormone-sensitive cases. Thanks to advancements in medicine, targeted therapies are now available that focus on specific cancer cells, leaving healthy cells untouched. Myths and misconceptions. Let's bust some common myths. Only women with a family history of breast cancer are at risk, but the fact is, most people diagnosed have no family history. Wearing underwire bras or using antiperspirants causes breast cancer? The fact is, there's no scientific evidence to support this. Understanding the facts can empower you to take the right steps. Personal stories and advocacy. At first, I was terrified when I found a lump, but early detection saved my life. Today, I'm cancer-free and advocate for awareness in my community. Community involvement can amplify awareness. Join campaigns, support local initiatives, and encourage loved ones to stay informed. Breast cancer is a challenge, but it's one we can face together. By recognizing the signs, understanding the risks, and taking preventive steps, we can reduce its impact. So here's what you can do today. Perform a self-exam. Schedule your mammogram. Share this video with someone you care about. Together, we can create a future where breast cancer is no longer a life-threatening disease. Thank you for watching.